face when I'm with you, but I love it, but I love it. Oh, I can feel my face when I'm with you, but I love it, but I love it. Oh, and I know she'll be the death of me. At least we'll both be numb, and she'll always get the best of me.
A face transplant is a treatment option for some people with severe facial disfigurement. A face transplant replaces all or part of a person's face with donor tissue from someone who has died.
Hi, my name is Emily, and I am a doctor that specializes in face transplants. Yesterday, I met with a patient named Robert who was in a car accident and now has many burns on his face. I am going to give you a step by step process on how Robert's appointment went. First, I started with a screening process that I will evaluate to determine if he is a suitable candidate, and if he is, he will be placed on a waiting list. A team will find a donor who matches the recipient's tissue requirements, such as similar age and the right blood type. A donor for Robert was found, so the procedure will be need to be taken in a timely manner and may be as long as 10 hours or more. The area most likely to be reconstructed is the central region of the face, which includes the nose and lips, for these are the most difficult to reconstruct with conventional plastic surgery. The team will work on removing the facial graft, which includes the entire nose, the soft tissue of the midface, including all its blood vessels, muscles, and nerves. After the procedure, a patient will be taken to intensive care due to the fact that the body's immune system can reject the new face and other donor tissue. After a few days of observation, a physical therapist will help the patient regain as much facial movement as possible. Robert Chelsea was the first ever African American face transplant. Many organ systems are involved in face transplants, such as the integumentary system, skeletal system, muscular system, nervous system, cardiovascular system, and respiratory system. Surgeons will also cut the face during the surgery using a coronal suture. Anatomy is important in face transplant procedures because surgeons must be very knowledgeable about the different organ systems that make up the face and being able to make all the right connections when placing the new face on the recipient. The treatment of disfigurements involves using a skin graft to repair facial tissue. These techniques are imperfect and can result in a serious loss of function and a lack of facial expression and visible difference in the appearance of the face. The first time I have ever heard about face transplanting was when I saw Katie Stubblefield's story on National Geographic. At age 18, Katie shot herself in the face her senior year of high school. At the age of 21, she is the youngest person to undergo this complex operation that takes months of planning and multiple surgical teams with only a few transplant centers worldwide. In May of 2017, Katie and her family got a call and was instructed to be at the hospital. The goal of her surgery was to fix mainly her nose and mouth, but her parents were given the decision whether to stick with the original plan or transplant the whole donor face. A big risk of a face transplant is if the patient becomes unstable in the middle of the transplant, regardless of how much you plan, and in this case, the surgeons made 3D models of her face. Katie's donor, Adria Snyder, was 31 years old when she passed away. Katie's total surgery was 31 hours long. Following her surgery, she remained in the hospital for a month and wouldn't have any nerve recovery for up to 6 months and possibly not being truly stable until 2 years after the surgery. 8 months after the surgery, Katie met Adria's mother. It has been several years since Katie's surgery, and she states that her face transplant was a second chance at life and a new beginning.